This segment of Delmarva Life is sponsored by TidalHealth.
Your body contains a unique and intricate network of blood vessels, arteries, veins, and capillaries. So, maintaining the health of your blood vessels is crucial for proper blood circulation, delivering the oxygen and nutrients to all the parts of your body. Vascular health is a critical system when it comes to your overall well-being and longevity. That's something that Dr. Douglas Wilhite focuses on as a vascular surgeon with TidalHealth. Thanks for coming in today.
Yeah, absolutely. Thanks for having me.
So, I want to talk about peripheral artery disease. What is that?
Yep, PAD. You know, when we talk about circulation, because everybody always is concerned about their circulation, just like you summarized, we talk about both veins and arteries.
Right.
Veins carry the blood flow back to our heart. The arteries, what we're talking about today, are the pipes that carry the blood flow from our heart out to our toes and our fingers.
Okay. So when you're saying peripheral, you mean the far edges?
That's correct. Yeah, we're talking about arms and legs. Most commonly, PAD, peripheral arterial disease, affects the circulation to the legs.
Okay. So any symptoms?
Well, the most common symptom is just the signs of not getting enough oxygen to that extremity. You know, our skin lives off of oxygen. The muscles require oxygen for power.
Right.
And so the earliest sign of significant PAD is that the muscles will run out of gas when you use them. So patients will say that they try to go for a walk and they can go a certain distance, and then suddenly the calf muscles run out of oxygen, they burn and ache, and you have to stop, wait a minute for that oxygen to catch back up, and then walk again. We call that claudication.
So PAD can really affect your overall health.
It can affect quality of life and your health. It's significant. You know, because if you lose that ability to go for a healthy walk, one of the easiest ways to stay fit and healthy as we grow up, all of the other components of your health begin to tumble once you stop walking. Right. So it's really important to focus in and identify this and look for ways to correct it early.
Yeah, that was going to be my next question. Walking is obviously a good thing to do. Are there other things that we can do that can prevent or at least limit the risk of PAD?
Yeah, some of the risk factors are beyond our control. If you have diabetes, you know, you can't change that, but you can try to control it. And the better diabetes is controlled, the less likely you are to develop PAD. Family history, high blood pressure, those things need to be aware of and medicate properly. The biggest reversible factor and the most common cause of PAD is tobacco use. Okay. Patients who smoke universally develop PAD. Yeah. Stopping smoking immediately stops the progression of PAD.
Okay. And
that's a really important lesson to take away, because a lot of people feel that, well, I've already smoked so much that I have a problem, why stop now? It makes a huge difference. Okay. Patients who have PAD and continue to smoke ultimately face amputation. They can lose a leg.
Oh my goodness.
If you stop smoking, that risk of amputation drops to almost zero.
Okay, so I've got PAD. Is there a treatment?
There is, and it's really simple at first. Go for a walk.
Okay.
If you have mild or moderate PAD, where it hurts you to walk a distance, if you go for a walk every day, and not trying to push yourself through that pain, but walk up to it and rest,
right.
Your body has built-in backup circulation, collateral blood vessels, that will grow in size and carry that blood flow for you if you tell it that you want it to.
Yeah.
So the majority of patients, over 95% of patients with PAD, will get better without surgery, just by going for a walk, modifying risk factors, and then a few medications to think about. Aspirin will help prevent clotting of the narrowed arteries. Statin medications to lower cholesterol will also help reduce the progression of PAD.
So is there somewhere we can go for a screening to see if we're at risk?
Yeah, absolutely. Almost every hospital in the area, as well as my office over at Mid-Atlantic Surgical Group, has a vascular laboratory, a place where you can have a simple non-invasive test with ultrasound where they just look at the arteries and tell you how they're doing.
Okay.
It takes about 10 minutes, and we're happy to help out.
And you can actually reverse some of the effects of PAD?
Absolutely.
That's incredible. Dr. Wilhite, thank you so much for talking to us. Appreciate you coming in.
Yeah, thank you very much.